When your clients age into Medicare, they have a choice for their supplemental insurance, Medicare Supplements or Medicare Advantage. So in this video, I'm talking about Medicare Advantage, which is known by many different names. Medicare Part C, which is Medicare A and B, original Medicare. Privatizing it turns it into C. When I say privatizing it, is because the Medicare money that the government would get to take care of you is given to the private insurance company. So, all your life you've worked and they've taken money out of your paycheck. That money went up to the government. When you turned 65, you signed up for Part B. That money also goes up to the government. If you elect for a Medicare Advantage plan, a private plan, the government is going to take their money, the A money and the B money, and give it to the private insurance company. And let's say this is Anthem Blue Cross. It's going to give Anthem the money based on the amount of money that the government knows that they would pay per member per county. It varies all across the country, but it's the government's program. They have the data. They know exactly that if they enroll somebody in Hamilton County, Indiana, that the average person is going to cost the government $6,000 a year. So they're going to give Anthem Blue Cross $6,000 a year, and then they say, okay, you have to follow all the rules of original Medicare. You can't just go off the rails here. You have to give them everything they would have gotten if they would have stayed on original Medicare. And you have to give them a little extra. You have to give them something more, and you have to pay for all their claims. So you got it. Here's your $6,000. If you can make money by keeping them healthy or making them healthier, you can make a tremendous windfall. If you can't, you take all the downside risk. So there's a misconception that when you buy a Medicare Advantage plan, you have given up Medicare. You no longer have Medicare, and that's completely untrue. Medicare, the federal program, is a bubble around Medicare Advantage. They govern it very strictly. They fund it. The money comes from them to the private insurance company. The private insurance company is the one that's administering all your benefits. So you will no longer use your Medicare A and B card. Your red, white, and blue card, you can leave that at home. You will only be using the card that you get from your Medicare Advantage company. That card will be your original Medicare in essence, and your supplemental benefits, the Medicare Advantage, and in most cases will also be your drug benefits. So one card instead of 3 cards. Medicare Advantage, also known as Medicare Part C, is also known as an HMO or a Medicare PPO, a Medicare fee-for-service or a cost plan. In general, when you're talking about Med Advantage, you have to break it down one more level and you have to say, what type of Medicare Advantage plan do you want? Do you want one that is a PPO or one that is an HMO? Now, preferred provider organizations or health maintenance organizations, the actual acronyms don't really pertain. What you need to know is a PPO is a very broad network and an HMO is very narrow. PPO costs more, HMO costs less. If you were buying the plan yourself, if I'm buying it for myself, I want the PPO if I can afford it. People that are on very strict budgets often opt for the HMO, and I've had many millionaires buy HMOs because they say, I don't go to the doctor anyway, I want to save the money. In general, you want to sell and buy a PPO because a Medicare Advantage PPO has a very large network. When I say a PPO is a big network, this is a one provider's PPO directory, and as you can see, it's quite big. It's almost every doctor and hospital in the state. This is over 2,700 pages. In contrast, the HMO book might be 100 pages. You save a lot of money with an HMO. There are many less providers in there. Now, this is broad strokes because this is going to vary by carrier, by state, all the way down to the county level because Med Advantage is filed at the county level. If you have a Medicare supplement in a state, it's available in the entire state, border to border. If you have a Medicare Advantage plan, it could be available in 6 counties. That can be frustrating because you become very well versed with this one plan and then your client comes to you from 2 counties over and you realize it's not in that county. It forces you to look at where you're selling and see the overlap, the footprint of those Med Advantage plans to find out how well versed you need to be in how many carriers. One might be broad enough that you can really master that one plan. You might be in an area where you really need to know 3 plans. So Medicare Advantage PPO allows you to go in network for a lower price, but it also allows you to go out of network. So it gives you that flexibility to go to the best clinics all around the country that are not in your network. You just pay a higher copay. Versus an HMO, and you are stuck within the confines of that plan. If your doctor is not in that plan and you want to see that doctor, then it's 100% out of your pocket. That's why when we're talking about the client and we're saying, which way should the client go? Medicare Advantage or Medicare Supplement? It's easy to talk about, are there doctors in the network? Are there drugs covered? Which one has extra benefits that are more attractive? But what people don't really think about is they don't get more granular to look at the actual client's lifestyle. How much do you travel? How close are you with your doctors? Now, if you live in Arizona, but you spend the summers back home in Utah, that means you could be out of network for 3 months or more of the year. Clearly, you don't want to be on an HMO because you'd be out of pocket. You'd be without insurance for those 3 months. This is where people get confused about private Medicare, Medicare Part C. They'll say, well, I'll just go with original Medicare then. Once you sign up for a Medicare Advantage program, you still are covered by original Medicare. They govern the system so that you are guaranteed certain benefits, but you no longer have benefits through original Medicare. So if you signed up for a Medicare HMO and you decided to go back to Utah, you have no insurance. Even though you paid in your whole life, once you elected for private insurance, you've agreed to get all your insurance through that contract. And when you went out of network, you've agreed that you'll pay it all out of your pocket. So it's an egregious mistake that people make when they say, oh, I'll take the HMO because it's $0 a month versus the PPO that's $50 a month, when they don't actually talk to their client about their lifestyle. How much do you travel? Where do you travel? Because there are Medicare Advantage plans that have out-of-network kind of travel benefits. They all call them something different, but they allow you to take an HMO and say, I'm going to go to California for the summer and still be in network. So this is something a little more granular that you need to talk to your Medicare mentor about if you run into somebody that really needs the lowest cost HMO, but they do spend a considerable amount of time out of network. In general, if they get all their doctor's visits and their children all live in the same town and they don't like to travel, which is a large section of the senior population, they're good, they're here, they're staying here, it might be a good plan for them. It's very low cost. But there is that risk that if they do get some kind of rare cancer and they want to go to one of the best cancer centers in the country, that they will find themselves in Jacksonville, Florida, and it'll be 100% out of pocket. So if you're selling Med Advantage, you want to push people over to the PPO side and start there. Can you afford the PPO? Because if they can, that's their best peace of mind, that's your best peace of mind, because they have the ability to go in network and out of network. I picked up the PPO directory again. You won't be using paper. You'll be going online to find the most up-to-date listing of the doctors in that network. But this is old school, and I've kept it around because it is fascinating. You're going to look up your client's doctors, and you're going to see Winston Davis. Aha, he is in the network. You will need his ID number to put on your application. So you will also see under his name if he's accepting new patients. That comes up more than you would expect, that clients say, I've just recently moved to Florida, we just retired, and I don't have a doctor here. In many ways, that's wonderful, because now we know we can sell this plan and we'll just pick doctors that are in the network. But there is a caveat, because not all the doctors are accepting new patients. Doctors don't want a lot of new patients on Medicare because their reimbursement is so low. So they cap it at about 10 to 15% of their practice typically. And when they hit that, they won't take new Medicare patients. So if you're signing up a client for a Medicare Advantage plan, HMO or PPO, you'll be required to list their primary care doctor on the application. And you'll have to list their I think it's like an 11-digit number on the application. If you fail to do this because your client says, I don't have a doctor, I never go to the doctor, I don't care, just put anybody down, then the company will auto-assign a doctor. When your client gets their ID cards from the insurance company, it'll have that doctor's name on it. Now this is a rookie mistake, because the client, as much as she said she didn't care, put any doctor down, I don't go to the doctor, I'll deal with this later, I just moved here and I'll worry about getting a new doctor in the future. Your client gets a card and it says they've got to go to this 27-letter long name doctor with a foreign name that they can't understand, and right away they're mad at you. So Don't allow that to happen. That's been a problem all across the country for years. If your client doesn't have a doctor, put the onus back on your client to go pick a doctor. Find a doctor that's accepting new Medicare patients. She doesn't have to go there, but have her give you that name when you fill out the application to put down as their primary care doctor. Now, on a PPO, they don't ever have to see that doctor. They have to have it on the card, but they don't have to go. And at PPO, you can go to any doctor in the network or doctors outside of the network. But the companies still require you to put a primary care doctor down on the card. And like I said, if you don't, they will auto-assign one, which is a typical breeding ground for complaints. So let's avoid that. With an HMO, this varies by carrier. Some of the HMO require you to go channel through that primary care doctor, and you cannot see any other doctor without a referral. And that's one of the reasons HMOs get a bad name, because it's that gatekeeper that prevents you from going to see that expensive specialist that saves the carrier money and causes a lot of frustration for your client and for you, the agent, when your client reaches back out to you. Not all HMOs require that, but they still will require you have a primary care doctor listed on that card. The short and simple difference of Medicare Advantage Part C is it is private. They will get their money from the federal government, and then the private insurance company administers all your claims. You will use your private insurance card, and you will deal just with that private insurance company, not with Medicare. So if you get your red, white, and blue Medicare card out and accidentally give that to the doctor's office when you go instead of your Anthem Blue Cross Medicare Advantage card, you will get a claim denied back, which will set off fireworks in your client's brain. What happened? They lost their Medicare. It's not true. They're still in Medicare. They have all the rights of original Medicare. It's all guaranteed to them from the federal government still, but it's being administered by the private insurance company that they purchased their supplemental insurance from. So to learn more about selling Medicare Advantage plans, stay tuned for my next video when I go into the actual agent requirements to be able to sell Medicare Advantage.